So what are the causes of ovarian cancer? The type of the cell where the cancer begins. So it's not clear, but what causes ovarian cancer? Those doctors have identified factors that can increasing the risk of the diseases. In generally, cancer begins when a cell develops in error mutations in its DNA. The mutations tell the cell to grow and multiply, creating a mass and also tumor of abnormal cell. But the abnormal cells continuously living when healthy cells would die. They can invade nearby tissues and break off from their initial tumor to the spread elsewhere in the body and metastasizes. So what are the types of ovarian cancer? The type of the cell with the cancer begins determine the type of the ovarian cancer. You have ovarian cancer types including firstly epithelial tumor. Epithelial tumor which begins in the thin layer of the tissue that covers the outsides of the ovaries, and about 90% of the ovarian cancers are epithelial tumor. So the next tumor is a stromal tumor which begins in the ovarian tissues that contains hormone producing cells. These tumors are usually diagnosed at an earlier stage than other ovarian tumor. About 7% of the ovarian tumors are stromal. The next ovarian tumor is germ cell tumor. Germ cell tumor which begins in the egg producing cells, but these are rare cancer tend to occurs in younger women. The next phase is what are the risk factor of ovarian tumor, and the factor that can increase the risk of ovarian cancer including firstly I tell about older age. Ovarian cancer can occur at any age, but it is mostly common in women ages 50 to 60 years. Second factor is inherited gene mutations. A small percentage of the ovarian cancer are caused by the gene mutations inherited from the parents, and the genes known to increasing the risk of ovarian cancer are called breast cancer gene 1 and breast cancer gene 2. These genes also increasing the risk of breast cancer, and also other gene mutations including those associated with lymph syndrome are known to the increasing the risk of ovarian cancer. The next factor is family history of ovarian cancer. People with 2 or more closely relatives with ovarian cancer have an increased risk of the disease. The next factor is estrogen hormone replacement therapy, especially with long-term use in large doses. And the next age is when the menstruation started and went in. Beginning menstruation at an early age or starting menopause at a later age or both may increasing the risk of ovarian cancer. So what are the preventions of ovarian cancer? So there is no sure way to prevent ovarian cancer, but there may be ways to reduce the risk of preventions. For likely consider taking birth control pills. Ask the doctors whether birth control pills may be right for the but women who are usually oral contraceptives may have a reduced risk of the ovarian cancer. The next prevention is discussed the risk of factors with the doctor, and also if the family history of the breast and ovarian cancer, so the doctor can determine when this may mean for the own risk of cancer. So in some cases your doctor may referring you to genetic counselor who can help you decide whether genetic testings may be right for mutations that increasing the risk of ovarian cancer, and you also may consider surgery to remove and your ovaries to prevent cancer.